This week's Tweak of the Week is all about a new skin booster called Revive. Now, skin boosters are injectable products. They're like injectable moisturizers, that's how I'd describe them. And I'm going to try this treatment out. So I've come to Chelsea to Skinesis Medical, where I'm going to see Dr Alexis Granite, who is a consultant dermatologist and who uses this new product. And she's going to explain to me what it is, why it's different, and do a treatment on me too. So come with me, we'll see what it's like. I'm here with Dr Alexis Granite to talk about and have a treatment with BELOTERO's new Revive, which is a skin booster. Can you tell me a bit about what this product is and what it does and how it works?
Yeah, so basically this is a skin booster, as you said, which contains hyaluronic acid and actually a little bit of glycerol.
Okay.
And those are basically to improve the skin's hydration. So
Right.
Skin boosters are great. They use hyaluronic acid similar to what's in filler, but they're not filling anything. So they're really all about the quality of the skin, hydrating the skin, giving the skin a nice glow.
Okay. In the face, you can inject this in a number of different places, can't you? It's not just confined to the cheeks.
That's right. So we can put it pretty much everywhere. And we often use a mixture of injection techniques, sometimes a little bit with a needle, a little bit with a cannula. And so it really kind of gets it to where it needs to go. But it is very versatile in the way that you can use it anywhere on the face.
Right, because I was wondering about having the barcode lip lines done here, because I know those are really difficult to tackle, aren't they?
Yes, they are. So this is great for that. The only downside to injecting there is it just is a little more likely to bruise in that area.
That's fine.
But,
yeah, I have all the high strength.
Yeah.
And then once it's in the skin, how long does it stay in the skin as a product? And how long does it take to see results?
Yeah, so usually you start to see results within the first 1 to 2 weeks. You'll get a really nice boost of hydration, a nice glow. And then the product lasts kind of up to 6 months. So depending on the state of the skin, at the start, we might recommend a course of treatments. So it may be that we do 1 or 2 syringes in one sitting, and then I may have patients follow up a month later and we would do another set of treatments just to really get that sort of long-term effect.
It's a really quick effect, isn't it? Because some skin boosters, you need to wait for 7 or 8 weeks to start seeing those results. Is that something to do with the formulation?
The hyaluronic acid really will pull in the moisture pretty quickly, along with the glycerol. So you will get some, very short-term improvement, but you are going to get that sort of long-term collagen stimulation over time.
Fantastic. So collagen stimulation as a side effect of the extra hydration.
That's
and
right.
So you get not just hydration, but tighter and springier skin as well.
That's right, exactly, kind of over the long run.
Fantastic, which we all need. Now I've got an ice pack here because there's
right.
no anaesthetic in the product put on beforehand. So yeah,
that's
I'm gonna.
I never put cream on anyone before. You okay?
Fine, yeah.
It was okay, right?
Yeah. Okay. Is this to test?
No, I do a little bit in the forehead. That's what's really nice with it. It's not too bad, right? I'm so mean. I never numb anyone.
It does sting a fraction more than
so
I might
that's
expect.
what everyone says. So, and I'm curious what you think when I do the cannula, because I've had some feedback that when I put it in with cannula, it does sting a little bit.
Okay.
Needle versus cannula. It depends sort of what you're injecting, but in this case, I'm just going to return your head a tiny bit that way. Really, it's about precision. So in certain areas, like the forehead, upper lip, maybe around the eyes, I want to be very precise where I'm putting it. I want to just use very small amounts. Whereas in the cheek, I really want to get the most coverage I possibly can and reduce the risk of bruising. So if I were to just inject your cheek all over, obviously there's just a higher likelihood you may get some bruising there. So a cannula is just a way to increase the spread without having to do a million different injection points.
Fantastic, because you can work in a kind of fan pattern,
That's
can't
exactly
you?
right.
Reach more areas, and the product itself is very fluid, so it will
disperse
around.
exactly. And how's the comfort in terms of
Comfort's fine. I felt a tiny bit of something from, which I presume was the product, but it's not in any way painful. What I'm looking for is a stinging sensation from the product as it settles in, but it's
not too bad.
I think I'm imagining that if there is, I'll say if I feel it. And with the cannula, you're working just sort of below
below the surface.
Yeah, I can feel where you're leaving it.
It does feel a little stingy.
Yeah, almost more tingly than stingy.
Mm-hmm. Well done. How you doing? Okay.
Absolutely fine. Yeah, thank you. Not even needing this lovely stress ball.
Good. Let's see where we are. We want to do about half on each side.
Somebody was telling me
the left is always worse.
The left is always worse.
Amazing.
Why is that?
It's something about brain chemistry. Isn't that amazing?
But therefore, always better to start on the right. So
yeah, so don't scare people off.
Yeah. So this is what I look like immediately after the treatment with Revive, and you can see the tiny swellings here and there, but I know those will go down quite quickly, like within an hour or so, and then I will sit and wait for results. But even the injections above the lip, you can't even see them. So this is really a very neat treatment for something that's going the whole way around the face. So that was this week's Tweak of the Week. Thank you very much for watching.